Assalamualaikum and good evening to our Madam Ms. Jamhira and to our fellow friends. We would like to present New Public Reform under Chapter 2, New Public Management. Assalamualaikum, I'm Danis and I will start our presentation first with introduction and I will explain first about the new public management. So around 1917, there are many criticisms on an effective administration which made the government to start focus on an explicit directive to change the result. So from August 1998, the traditional working principle and practices are outdated and it is not fit with the growing demand of community nowadays. So the new strategy for public management under the term of new public management is necessary. And the new public management start in 1970s and 1980s. And for the first to adopt this NPM is under the United Kingdom under Margaret Thatcher, who is the Prime Minister of England. NPM is modern politically conservative initiative for the government institution to reduce dependency on bureaucracy and adopt methods of doing business from the private sector and its management practice. It is an important model of governance to provide new techniques for the public administrators based on model from the private sector. And then based on Wood 1991, the term NPM implies a paradigmatic shift from the traditional public administration model, and the main aspect of NPM such as the concept of market competition, management of companies, service quality and cost effectiveness may be seen in these many countries nowadays. And NPM places a strong focus on the deployment of market system in public sector because it was created using a private sector concept. So move on with privatization. In 1980s, the beginning of Malaysian government's goal of privatization with the creation of Malaysian Incorporated Policy by Datuk Sri Dr. MOHD. And the main goal was to lessen the financial strain on Malaysian government during the implementation of the new economic policy NEP, which intended to eradicate the inter-ethnic gaps and to reduce the poverty. And based on SARG 1994, the public sector change required as the government role change from the direct intervention to indirect and supportive one so that it can carry out its new role successfully. And from then on, there have been major improvements made to public sector in Malaysia, and many of the public assets have either been privatized or contracted or rented out. Also, there are various public monopolies that were made open to newly licensed private suppliers for the competition, but the right conduct of privatization must be taken into consideration during the implementation phase in order for the privatization to be implemented. And if there is improper conduct of privatization, there may be ineffective result and may face loss of welfare. And moreover, according to Cook and Kirkpatrick, any public sector reform strategy that has the effect of enhancing the market influence over the resource allocation and utilization is referred to as privatization. That's all from me. We'll pass it to the next presenter.
After that, we will move to the symptom or condition of the issues or problems that have divided by privatization in toll highways and privatization of healthcare.
Assalamualaikum and hi, my name is HUSNA BINTI HAMIDEE. I will continue the presentation with the first issue under privatization, which is privatization in toll highway. The first problem that occurs under privatization is under the implementation of toll highway construction. The construction of toll highway is one of the important projects under the privatization initiative. In Malaysia, the public sector was solely in charge of building and maintaining public roadways until the middle of 1980s. The Public Works Department, which is a government organization that falls under the Ministry of Works, is in charge of building the nation infrastructure. Since the middle of 1980s, the majority of the highway growth has been supported by the building of 1,800 kilometers of toll highways. Firstly, for the toll highway cases, there is no independent regulatory authority to supervise the concession firms. The Malaysian Highway Authority is a governmental organization rather than a separate regulatory entity. It is in the charge of the regulatory system for the planning, building, running, and maintaining the privatized toll highway projects, but not for the management and toll charge themselves, and it will affect the public rights in paying the toll. Okay, we move to the next point, which is the problem is lack of the transparency. This issue happens since there is little consultation towards the public or the road users. The government also did not involve the public in giving their opinion and told the public or the end users of the toll charges and structures that led to the public protest. The wider public transparency and openness were anticipated to encourage increased effectiveness in pursuing the interests of the public while reducing the waste and overspending. Opposite to these assumptions, privatization as a whole does not promote accountability or combat the corruption. It may also lead to other issues like new forms of corruption, as it is rarely applied on a system-based basis. Privatization only increase profit, it does not improve the efficiency, as in certain economies the public sector can be managed more effectively.
Assalamualaikum warahmatullahi ta'ala wabarakatuh. My name is ADLINA binti ZULKIFLY, and I will continue to explain about the issues. The issues is privatization of healthcare. According to Chan 2010, the argument for privatization depends on how well allocative efficiency can be advanced by the free market forces. This is because increasing and improving the health sector's economic effectiveness was the objective of privatization. Support services in the health sector are one of the privatizations of healthcare in Malaysia that has been done and provided by the government. Starting in the early 1990s, a decision was taken by the government to privatize the support service in the health sectors, which includes of four, which are the supply of hospital support services in 1993, the supply of pharmaceutical services in 1994, monitoring consultancy services in 1996, and monitoring and supervision of foreign workers' health certification in 1997. The development also considered with the Ministry of Health plan, in which public hospitals did not have a proper advanced tools and facilities for their patients, so they plan to privatize clinical waste management services. Two developments that need government attention are to provide medical care, the cost increase, and the burden to offer a wide range of services to the public, including those that related to administration, support, medicine, and others. Next is resistance to privatization. Privatizing healthcare is not easy because it will get opposition from various parties and people out there. For example, even though they receive significant support and encouragement, there remain resistance in the expansion of private hospitals. This is because in 1992, the government announced the privatizations of hemodialysis clinics, but due to no implementation in 2 years, it has shown relevant resistance to health services. One action of the government is offering the poor people subsidized dialysis treatment, because the government only charges 10 ringgit when patients use the public facilities, while private clinics charges 150 for patients to use their facilities. Another reason why the government does this is to ease concerns about equity.
Then moving on to the causes and implications of privatization in toll highways and privatization of healthcare.
Assalamualaikum, my name is AQILAH binti AZMI and my metric number is 202095257. So I would like to talk about the causes of privatization in toll highway. So for the first one is reducing government financial burden in road infrastructure. As we can see, the establishment of toll highway for the road infrastructure in Malaysia have been improved in contributing the economy without significantly impacting the government financial and budget to the public. Besides, it also reduced the government expenses. For the budgeting 2020, we can see there is toll discount as much as 18%. At the tabling of the Malaysian Budget 2020, it has been announced that Plus Malaysia will offer a minimal reduction of average toll charge by 18% discount for all its highway from 2020. Besides, the government will evaluate proposal based on its positive fiscal impact while not increasing the debt shouldered by the government. We can see here there is no debt that will be covered by government when we establish the discount up to 18% at all highway operated by Plus. In fact, this will translate to RM 1.13 billion worth of saving to a highway user for the year 2020 and RM 43 billion throughout the remaining year of the highway concession that will end in 2038. Besides, in budgeting also said that the government will introduce a congestion charge that will be imposed during peak hour, and the charge will be 30% lower than the current toll rates during normal hour. Besides that, they will also to be no toll during off-peak hour for this highway, and this will provide saving as much as RM 180 million per year or RM 2 billion saving until the end of the highway concession period. Another causes is to increase private sector road infrastructure development. As we can see lately, there are so many accidents happen because there is no light on the road when we meet the midnight. So the private sector can also provide many lights on the road, so it more safety to the highway user. Besides, to be more good in maintenance, the private sector can also provide many border or cone to prevent any accident and make sure there is that the road the holes on the road can be covered immediately, so some motorcycle cannot get into the holes and get accident. Besides that, the private sector also needs to be more convenient by providing mosquito at the sites and providing any toilets so that the highway user be more convenient in using the. There are some implication privatization in toll highway. So the advantages is the road can be used by the highway user, can reduce their travelling time because there are so many toll highway, and by that the major private highway that have been established is the North-South Expressway, Shah Alam Expressway, North-South Expressway Central Link and the KL Karak Highway were completed in the 1990. This can help many people and can reduce their time consuming. Besides, it also provide many job to the public because when there is a toll highway, there will be some new workers that need to be used to handle the toll. And operation maintenance of the highway is highly cost because some of the highway need to get more maintenance and more focus, such as to provide many facilities such as toilet, mosquito, and different highway can give different facility because there are so many different of users, and by that this can impact the budget for the sector such as education and health, and because of the service such as peronda, petrol and rest and service RSA is needed, so the focus on the budget to improve the facility or conveniency is more increasing, and this will make the effect on other sector.
Hi, Assalamualaikum. My name is ADAWIYAH binti ROSZAMAN. So I would like to continue for the causes for privatization of healthcare. So the first cause is demand for health services. In the change of local and global scenario, where the public administration is expected to do more and more demands are being voiced by the people for better services. The rising demand for health services over the years has strained the public healthcare system. In 1956, the country only had 42 primary healthcare centers, and after independence, the health sector became an important part of the country's growth and development. It has driven a change on the healthcare services, which requires working with the governments and quasi-government players in the private sectors. An increase in population growth has changed the structure of the healthcare service in the needs to fulfill the demands of the public. A significant percentage of the population is experiencing economic transition, and chronic disease have represented almost 70% of deaths. So by 2040, 11.4% of Malaysia total population is expected to be 65 years old or older, and Malaysians are expected to live longer. This which will put more pressure on his healthcare resources. So next is poor performance in the public sector. Such clinics have been created for the poorest urban population, which sometimes might pressure for the waiting line and availability for medicines or professional specialists for them. So about 20% of the clinics with the highest patient loads are manned by medical professionals, while the remainder are staffed by assistant medical officers who can only treat a restricted range of conditions. This indicates that a low percentage was limited to the specialists provided from the public sector. It is also estimated that 58.8% 8% of the professional work in the private sector and 41.2% in the public sector. The fact that leads to an imbalance of the distribution of manpower from the public sector. A positive impact is that market capitalization has a greater influence on a country's development. This is due to the public sector having influential connections with the private company. Private sector is more concerned with profits, growth and market share than with broader moral consideration of public benefits. It indicates that public and private operators can learn from one another to increase efficiency. This can be viewed from the concession given to the three companies, which are Faber Mediserve Sdn Bhd, Radicam Sdn Bhd and Pantai Medifast Sdn Bhd, whereby each company was given a part of the market power. For negative implication is a financing burden. As the hospital in the health sector will be operated on a for-profit basis, the government acknowledged that operating expenses may rise. So, however, it has made a substantial reduction in the total number of workforce in the public sector possible. It is the administrative and financial burdens of the government to a large extent.
Assalamualaikum warahmatullahi wabarakatuh. My name is FAZREEN binti Muhammad Fazli and I will explain to you about our recommendation and suggestions. So, for the market economy's ability to function poorly due to low transparency, little public participation and lack of information throughout the process, Malaysia must prepare for its regulatory procedure and clear, transparent administrative process that prioritize accountability and good governance, so it might have had better success with the privatization of the public sector. To create policies that can better address these public concerns while maintaining the financial viability of the sector, Malaysia's Toll Road Public-Private Partnerships (PPP) initiative is using a complex, large-scale, interconnected, open and socio-technical approach established at the Massachusetts Institute of Technology. The political risks associated with the program should be addressed, and long-term stability for the government and consciousness should be enhanced through greater transparency and public participation. In our opinion, we believe Malaysia needs to set up a special body to oversee management and toll fees in response to the problem of the absence of an independent regulatory authority to monitor the concession corporations. All expressways and toll roads in Malaysia are subject to regulation and oversight by the Malaysian Highway Authority, which also acts as an executive branch body. However, the proposed special agency is intended to monitor toll payments made by the general public, offer assistance, take complaints, and take necessary measures to improve the effectiveness of the toll highway after privatization. This special agency can carry out all of that operations by using proper channels. Okay, so concerning the resistance to privatization, the Malaysian government also established a scheme in 1994 that permits up to 10% of an individual's provident fund, also known as an EPF or Employees Provident Fund, to be withdrawn for life-saving medical procedure as well as to be as part of the voluntary programs to purchase private health insurance. To motivate saving for healthcare and health insurance, the tax relief for approved pension funds and life insurance premiums were also raised by 2,000 to 7,000. Besides that, in order to promote an environment where competitive healthcare business may operate efficiently and prevent abuses that commercial entities can exploit to increase their profits, the regulatory role of the government should continue to be strengthened in order to maintain access to healthcare for those sections of the population who need it the most. Positive discrimination in favor of the socially disadvantaged should persist. So that's all from me. Thank you.
Last, for conclusion, so the public sector nowadays implement new reform measures, and many of which fall under the new public management concept, with the goal of improving the public service efficiency in regard to the economic and social development and the quality of its relationship with the private sector. And thus now it can be seen that the privatization approach used in Malaysia to reform and improve the public sector has produced a great advantage and benefit. For example, just on the toll highway alone, it has been successful in providing hundreds of kilometers of needed road, and the benefit were by way of faster the mobility of goods and people. But privatization program in Malaysia has many flaws that prevent it from better satisfying the societal demands, despite the fact that most Malaysians recognize it as an advantage or benefit. If Malaysia has planned for its regulatory procedures and transparent the administrative process that prioritize the accountability and good governance, the country privatization of its public sector will have performed better. That's all from us. Thank you.